Hi everyone, I'm Shilpa Mohanan from the Academy of Online Radiology Education. I work at University of Arkansas for Medical Sciences at Little Rock, Arkansas. Before introducing you to the interesting articles for this month, I would like to thank our senior editors Dr. Avnish Chabra, Dr. Keda Jambegar, and Dr. Manikam Nixkumaravel for their contributions to this blog. Moving on to the first article, CT Phantom Evaluation of 67,392 American College of Radiology Accreditation Examinations, Implications for Opportunistic Screening of Osteoporosis using CT. This was a retrospective study. Data on attenuation measurement accuracy were acquired using the ACR accreditation Phantom and were evaluated in a blinded fashion for 4 CT manufacturers. The attenuation value for water, acrylic, which is a surrogate for trabecular bone, and Teflon, which is a surrogate for cortical bone, for an adult abdominal CT technique was used in the analysis. The conclusion was CT scanners made by different manufacturers show systematic offsets in attenuation measurement when compared with each other. Knowledge of these offsets is useful for optimizing the accuracy of opportunistic diagnosis of osteoporosis. Low dose CT in pelvic imaging, comparing dose and image quality in relation to clinical value in a phantom study. In this phantom study, the dose measurements, objective and subjective image quality, and figure of merit calculations between conventional radiography and CT performed with and without thin filtering are compared to determine the optimal imaging technique for examination of the pelvis. The conclusion was low-dose CT was superior to radiography for visualizing and evaluating the dorsal pelvic ring, with only marginally higher radiation exposure occurring when the latest generation CT systems were used. Tin filtrations can improve image quality, create further dose reductions, or provide both benefits. Differentiation of vertebral metastasis from focal hematopoietic marrow depositions on MRI. Added value of proton density, fat fraction. This was a retrospective study including 44 patients with 30 vertebral metastasis and 14 focal hematopoietic marrow depositions who underwent spinal MRI. Chemical shift encoding based water fat MRI is an emerging non-invasive method of assessing the proton density fat fraction, or PDFF, which is a promising quantitative imaging method for estimating vertebral bone marrow fat concentration. The conclusion was the addition of PDFF to a conventional MRI protocol improved the diagnostic performance for differentiating vertebral metastasis from focal hematopoietic marrow depositions, but without resulting in significant improvement in sensitivity and specificity. Whole body low dose CT in multiple myeloma, diagnostic value of appendicular medullary patterns of attenuation. This was a retrospective study involving a total of 76 patients, including 42 men and 34 women. The medullary cavities of femurs and humeri were evaluated qualitatively and quantitatively on CT. Medullary attenuation and SD to mean attenuation ratio were recorded for each long bone. The pattern of marrow involvement on spinal MRI was used as reference. The conclusion was, according to analysis of peripheral medullary patterns of attenuation, whole body low dose CT can identify patients with multiple myeloma with diffuse marrow involvement. MRI criteria for meniscal ramp lesions of the knee in children with anterior cruciate ligament tears. This was a retrospective study including 85 children who underwent a preoperative MRI examination and arthroscopically guided primary ACL reconstruction. Blinded to arthroscopic findings, 2 radiologists reviewed all MRI examinations and reached consensus on the presence or absence of an effusion and various findings within the medial and lateral tibiofemoral joints. The conclusion was MRI findings associated with an arthroscopic diagnosis of meniscal ramp lesion include medial meniscus tear, peripheral meniscal irregularity, junctional fluid-like signal, and capsular ligament tear. Development of MRI-defined structural tissue damage after anterior cruciate ligament injury over 5 years, the Canon study. This was a secondary analysis of a prospective trial to determine the frequency of structural tissue damage on MRI scans at 2 and 5 years for a non-surgical versus a surgical treatment strategy in the knee anterior cruciate ligament, non-surgical versus surgical treatment or Canon study. 119 participants with an acute ACL injury were included. The authors concluded that young adults with anterior cruciate ligament injury showed No major difference in frequency of structural tissue damage on MRI scans at 2 and 5 years, regardless of treatment. However, the rehabilitation alone group had less inflammation at 2 and 5 years. MRI-based synthetic CT in the detection of structural lesions in patients with suspected sacroiliitis, comparison with MRI. This was a prospective study. On 30 participants with clinical suspicion of inflammatory sacroiliitis, MRI and CT of the SI joints were performed on the same day and synthetic CT images were generated from MRI scans. The conclusion was, with CT as a reference standard, synthetic CT of the sacroiliac joints has better diagnostic performance in the detection of structural lesions in individuals suspected of having sacroiliitis compared with routine T1 weighted MRI. Ulnar collateral ligament injuries of the first metacarpophalangeal joint, prevalence of associated injuries on radiographs and MRI. This was a retrospective study including 25 patients with an injury of the ulnar collateral ligament at MRI. Presence of associated injuries to the volar ligaments like chacrine and phalangoglenoid ligaments and volar plate was assessed on radiographs and MRI independently by two musculoskeletal radiologists. Conclusion was, ulnar collateral ligament tears are often associated with volar ligament injuries, even in lesser degrees of ulnar collateral ligament injury. So that's all we have for this month. Thank you very much for listening. For more details, you can read our blog where we have given the link to individual articles. Thank you.